I mentioned that IOIBD got busy developing through various task forces advice for doctors and patients. And so among that was advice on endoscopy and some guidance about who should be scoped. And it prompts us to wonder, do we always have to scope, or can we monitor patients in other ways? Part of that, at the origin of that monitoring patients, has to do with the notion that that patients do the best if we set a goal for treatment and really try to figure out if they've achieved that goal, right? So I say the royal we has found that when ulcerations heal in the lining of the intestine of patients with Crohn's and ulcerative colitis, that not surprisingly, they're less likely to, have long-term bowel damage and need to be hospitalized, and those are laudable goals. And they've been very much endoscopy based, but there are many other tests that need to be developed or can be developed that might allow us to get away from always needing to do endoscopy to figure out if someone is really getting better, to complement the symptoms that one can ascertain. I'm not trying to sell you on this particular test. This just happens to be a blood test that can be done in Crohn's patients that actually relates pretty well with a pretty high sensitivity and specificity to what's happening by colonoscopy. But I'm sure there are many tests that are being developed that would do something like this. And then the holy grail would be to have a test like this that patients might be able to do at home, like you would a finger stick. Okay, how about using technology, right? This, again, Zoom is like a verb now, right? We've been Zooming. This is a GoToWebinar. It doesn't roll off the tongue quite as nicely, but using technology to our advantage. So you may all have a different app on your phone, right? Like, who doesn't have Poop Master? No, I don't have Poop Master, but there are all these apps that you could be logging, that one can be logging in symptoms, right? And in the kind of in certain countries, including in a limited extent here in the United States, there are apps that are linked to the doctors taking care of those patients so they can get a flag that a patient that they're following is not doing well. This is just an example of all the different apps that are available. Those are apps, you have to put in data. But what about data that we are collecting inadvertently, even when we don't want to be collecting the data? And that's data that's on our, we're carrying around our iPhones, we're wearing Apple Watches and other watches, and of course Fitbit devices that are monitoring all sorts of things that might actually give us a sense of whether or not someone is doing well. David Rubin at the University of Chicago shared a few slides with me of very interesting stuff they've been doing now for a while, where they've been collecting using Fitbit's data on physical activity and on sleep, and matching that with data that patients are entering in their smartphones about their symptoms. And they have found that, for example, the resting heart rate, if the resting heart rate has gone up very subtly, right, very subtly, has increased, patients report pain the next day. So it's almost like a harbinger. The patient might not be aware that there's anything wrong yet, but physiologically changes are taking place that are being represented in heart rate or in sleep disturbances. And if we could intercept it while patients were still not symptomatic, I think that would be amazing. So, you'll be happy to know, Gil and Eric, this is my last slide. I think the IBD clinic of the future will be far more patient-centric. It doesn't have to be just where the doctor happens to be seeing patients. It's going to be mobile. It's going to be where the patient is, and probably less frequently do we have to be together all the time. It may use technology to help intercept flares, so keep flares from happening by measuring physiology in a non-invasive way, whether non-invasive is as you're carrying your iPhone, as you're wearing your devices. I think in addition to that, telemedicine, of course, will continue to improve, right? And such that there will be better cameras, better things, better ways of doing an abdominal exam. But I certainly feel, I've had patients show me their abdominal wall Okay, I'll ask them to show it to me from the side. I'll ask them to press on their stomach. I mean, kind of low tech, but nevertheless, it does the job. And what's beautiful is that it's no longer geographically restricted, that, you know, patients can, we can cross borders, and I look forward to that.